Hey guys, my name is Daniel Farivar.
And I'm Mohsin Ahmad.
We're third-year medical students working on the mother-baby unit, and we'd like to talk to you a little bit about postpartum depression. So postpartum depression is divided into two parts based on timing, the first being postpartum blues, and the second being postpartum depression. So you would see postpartum blues about 2 to 3 days after birth, and it typically resolves on its own after about 2 weeks. Some symptoms you may see are mood swings, anxiety, sadness, feeling overwhelmed, crying, reduced concentration, and trouble sleeping. Now, this is very common. It's seen in about 50 to 85% of new mothers. So, this is not considered a psychiatric disorder and does not require medical attention. As I had mentioned on the previous slide, this typically resolves on its own. Now, if depressed mood persists beyond 2 weeks after birth, this is usually called postpartum depression. This can sometimes begin even during pregnancy or anytime within the first year after birth, even without those first 2 weeks of symptoms. Symptoms of postpartum depression will be more intense than those in postpartum blues. You'll see severe mood swings, excessive crying, difficulty bonding with your baby, withdrawing from family and friends, fear that you're not a good mother, feelings of hopelessness and worthlessness, and thoughts of harming yourself or your baby. Now, you may not experience all of these, but definitely some of these if you think you have postpartum depression. This occurs in about 10 to 20% of new mothers and warrants seeking medical attention.
And let's not forget about dads. It turns out that up to 10% of dads too can experience postpartum depression. A related condition is called postpartum psychosis. This is a rare condition that typically begins about 1 week after birth. It's characterized by confusion and disorientation, obsessive thoughts about the baby, or thoughts of harming the baby. It's also characterized by hallucinations and delusions, excessive energy or agitation, sleep disturbance, or paranoia. So, what should you do if you're experiencing symptoms after birth? You're going to want to talk to your doctor if your symptoms last for longer than 2 weeks, if caring for your baby becomes hard, or if everyday tasks become hard. Prompt treatment can help manage your symptoms and help you bond with your baby. Your doctor may recommend counseling or medication. Counseling can consist of things like talking to a therapist to talk through some issues, getting help from a social worker with your baby, or learning new stress reduction techniques like meditation. Medications can include antidepressants like SSRIs. If you experience thoughts of harming yourself, reach out to a close friend or your partner, reach out to a mental health professional, or call the suicide hotline at 1-800-273-TALK. If you're experiencing thoughts of harming your baby, talk to your doctor immediately, as this could be a sign of postpartum psychosis. Congrats on being a mother!
It's a lot of work, so make sure to take care of yourself, but it's going to be great. Congrats!